Hi everyone, thank you for watching this short video today. So by way of introduction, I'm Andy Milne and I'm head of the Better Health Generation UK. So just to set the scene, at the Better Health Generation, we work in partnership with Able Futures to be able to deliver the Access to Work mental health support service across the whole of Scotland. So essentially, Able Futures are the prime contractor with DWP who fully fund this service, and we are a delivery partner to organisations across the whole of Scotland. So we promote and deliver the service to organisations and employees. Our 9-month mental health support service is all around being able to help individuals focus on their well-being and their mental health to be able to ultimately improve an individual's mental health and well-being whilst at work and in their personal lives, but also to help reduce absenteeism and sickness rates. And hopefully over the next sort of minute or so, I'll be able to show you how we're able to achieve this. So in terms of eligibility criteria, the service is available to all the employees across Scotland. So it's been designed as a catch-all service. So any individual who's aged over 16 and is in some form of paid employment, whether that be part-time, full-time, permanent contracts, agency contracts, they can be attending work or off sick, and they don't have to have a diagnosed mental health condition. So it can be very much a preventative support, a mild or moderate challenge around their mental health that they may be facing. So as long as an individual is in some sort of employment, they will be eligible for this service. And the aim is really to provide support, advice and guidance for individuals to be able to cope better with their mental health and wellbeing challenges that is affecting their time at work. So with their clinician, they will have 9 months of one-to-one support. That will be with one of our mental health nurses, counsellors or occupational therapists. So we'll create an action plan with the individual that's tailored to their needs. Then we'll catch up over regular phone calls, either fortnightly or monthly, over 9 months to be able to help build practical coping mechanisms and strategies. So as you can see on this slide, there's a really wide variety of different areas where we're able to provide support for the individuals, whether that be dealing with stress and anxiety, whether that be coping with change, managing emotions, developing sleep routines, etc. So we're really there to be able to provide the support for the individual across a 9-month period. Everything's delivered remotely and one-to-one, so via phone call or Microsoft Teams, and it is different to an EAP service. So it is classed as a non-clinical service. So we are able to sort of help individuals build the coping mechanisms and strategies, but we won't go into the counselling service as such. But we will provide the individuals with building the support mechanisms for the individual to be able to move forward. It's probably fair to say that this has been DWP's best kept secret because it is fully funded for all individuals to access free of charge at no cost. We are working with some really large organisations, the majority of the local authorities, the NHS, through to individuals who are self-employed. So we're here to be able to help. It is a fully self-referral process and in full confidence. So the individuals, the employees accessing the service are able to have that peace of mind that the individual won't be able to, we won't have to disclose anything to any employers as such. So it is in full confidence. So the referral process is open. We're able to offer that support as of now, and we'd love to be able to provide your staff and your organisation with the mental health support for all the individuals within your business that may need that support. Thank you very much.
Thank you for sharing that, Andy. Can I ask a couple of quick questions that I'm sure some of our employers will want to ask off the back of that? You mentioned there that you have got the resources available to help employers promote this service to their workforces. Could you tell us a little bit about what's included in that?
Yeah, absolutely. So what we've tried to do is embed it within the organisation. So we have all the marketing collateral. So we have posters, we have flyers that can be sent out electronically or put up in staff rooms, in kitchens, etc. We have all intranet content. We have pre-made emails. So we just try and make it as simple as possible, really, for the HR departments, wellbeing departments, or line managers to be able to cascade that information over to their staff members. Really, we will deliver, presentations to sort of senior management teams, to departments, to mental health first aiders, wellbeing champions. So we really do try and sort of spread it across the company, so as many people within that organisation are aware and are able to signpost other individuals for that support. So yeah, we will provide a sort of full comprehensive marketing pack to make it as simple as possible for the employers to cascade down to their staff members.
And as part of that, will that include information that, for example, their mental health first aiders or their wellbeing champions can pass on to their colleagues about how they can self-refer into that service?
Yeah, absolutely. So through all the emails and the marketing collateral, it'll have signposts to the Able Futures website, where an expression of interest can be made. There'll be phone numbers on there that the individuals can self-refer to make that application. So yeah, it's really easy for the individuals to be able to signpost other colleagues and employees to be able to get that support. So yeah, we will definitely send a full sort of comprehensive marketing plan. There's all sort of the different content that we have in a variety of different formats to make it as super simple as possible.
That sounds brilliant. Thank you very much, Andy.
Thanks, Rachel.